Welcome to your healing place. I'm Dana Briggs, and I would like to help you be more comfortable in your body. And I'd like to explain to you some techniques that will help you be relieved from tension and pain. And we're going to start with the hands first. But I want to tell you that there is a component to this that you may not be aware of, and that is the like web. It's kind of like a spider web that it covers everything inside your body called fascial tissue. And this technique is called myofascial release that was developed by John F. Barnes, who's a physical therapist many years ago, back in the 70s. And he is still teaching. I learned from him, and I've been doing this for about 10 years. This technique will help you to feel more comfortable, to have relief from pain and stress in your body, and to unwind the puzzle as to why you might have a lot of tension in your hands, but you're feeling the most pain in in maybe your shoulder or your hip. It's kind of a mystery the way that it works, but because it's like this web and it covers all the inside of your body, head to toe, and it clamps down on your tissues, your organs, your bones, your tendons, your muscles, anything that has some kind of stress in it, or you have surgery or illness. There's a variety of reasons why this can happen, that it will lose its elasticity and its movement and just become like this glued down film over everything, so that there's a lot of pain. Okay, so I'm going to focus today on your hands and fingers, because we use our hands a lot in our daily lives, whether it's on the computer or you're a dental assistant or you just like to do handwork. There's a variety of reasons why we would have repetitive use. And so I'm going to show you how to unwind that fascial tissue, release it, and get amazing relief. We're going to start with a thumb, and you're going to just gently pull your thumb away from this joint right here and hold. And you're going to hold it for at least 2 to 5 minutes, or until your hand stops moving, because there will be an involuntary movement in your hands. Now, you may not notice it right away because you've never done this before, or some of you will respond immediately. I respond immediately because I've been doing this for 10 years and my body is trained to know that when it starts feeling some light tension pull, that it is going to unwind. And so you can just see that my hand is doing some involuntary movement right now and twisting, affecting my arm. So I will explain to you what I am feeling at this point. It's just a slight tension, especially in the first 2 fingers, and a little bit down the palm into the wrist. So my left hand is following my right thumb in this process. And the unwinding is crucial to having real relief and results. So it kind of requires that you not be inhibited about the fact that you're moving involuntarily and might seem a little strange to you. But what it is like a miracle, because it really does relieve pain and tension by allowing that fascial tissue to become more soft and supple and wavy like it's supposed to be. And it will also help to relieve other aches and pains that you have throughout your body. Like I actually am feeling in my chest, in the pec area, some slight pull. So the tension that's coming from my thumb is traveling all the way up into my pecs, in the center where the sternum is. And so you want to become very body aware when you're doing this. You want to not have a lot of distractions, so that you can first learn what to feel inside of your body. So once you're really adept at it, then you can be watching TV or having a conversation with friends or family, and the process will just happen. But when you're first learning how to do this, then it's really good to become very body aware, as I said, and to feel where in your body other pulls are happening, and you're able to relate them to the fact that even though your hand is the one that's bothering you, there are other places in your body that are being affected by that fascial pool. Okay, so you would just be continuing until your hand would stop moving. So I'm just going to stop it right now, which you can do, but you would want to come back, and you may realize that when you come back, say an hour later, when you pick it up again and you have more time, that there will be a lot of relief from the first time that you did it. So you may not have to do the unwinding for very long. But I can guarantee you that you will get relief. And so you want to start with the digit, whatever finger or your thumb is bothering you the most on whichever hand, so that you can unwind it and have amazing relief. I love to hear your experiences or your questions, so just write them in the comments and I will respond to you. So I hope that this will be a good journey for you.